Good evening, comrades. I'm here to notify you that we have not been following orders. Слушайте этот разговор. Okay, I'm not really going to do it all in Russian. In case you don't know, this is where we're wrong. This is what we have to follow. Okay, this was published in May of 2020. And I don't want to hear any of you guys not following orders. So, this is YouTube's COVID 19 medical misinformation policy. The safety of our creators, viewers, and partners is of our highest priority. We look to each of you to help us protect this unique and vibrant community. It's important you understand our community guidelines and the role they play in shared responsibility to keep YouTube safe. Take the time to carefully read the policy below. You can also check out this page for a full list of our guidelines. YouTube doesn't allow content about COVID 19 that poses a serious risk of egregious harm. YouTube doesn't allow content that spreads medical misinformation that contradicts health authorities, local health authorities, or World Health Organization medical information about COVID 19. This is limited to content that contradicts the World Health Organization, local health authorities' guidance on treatment, prevention, diagnostic, transmission, social distancing and self isolation guidelines, and the existence of COVID 19. Note, YouTube policies on COVID 19 are subject to change in response to changes to global or local health authorities' guidance on the virus. This policy was published on May 20th, 2020. So you must remember that they knew everything by the time May 20th ran around, and we were wrong. We were wrong to say anything against this. What this policy means for you: if you're posting content, don't post content on YouTube if it includes any of the following: treatment misinformation, content that encourages the use of home remedies, prayer, or rituals in place of medical treatment, such as consulting a doctor or going to the hospital, content that there's a guaranteed cure for COVID 19, other content that discourages people from consulting a medical professional or seeking medical advice. Prevention misinformation, content that promotes prevention methods that contradict local health authorities or the World Health Organization. Claims that there is a guaranteed prevention method for COVID 19. Claims that any medication or vaccination is guaranteed prevention method for COVID 19. Claims about COVID 19 vaccinations that contradict expert consensus from local health authorities or WHO. Claims that an approved COVID 19 vaccine will cause death, infertility, or contradiction of other infectious diseases. Claims that an approved COVID 19 vaccine will contain substances that are not on the vaccine ingredient list, such as fetal tissue. Claims that an approved COVID vaccine will contain substances or devices meant to track or identify those who received it. Claims that an approved COVID 19 vaccine will alter a person's genetic makeup. Claims that any vaccine causes contraction of COVID 19. Claims that a specific population will be required by any entity except for a government to take part in vaccine trials or receive the vaccine first. Diagnostic misinformation, content that promotes diagnostic methods that contradict local health authorities or WHO. Transmission misinformation, content that promotes transmission information that contradicts local health authorities or the World Health Organization. Content that claims that COVID 19 is not caused by a viral infection. Content that claims that COVID 19 is not contagious. Content that claims that COVID 19 cannot spread in certain climates or geographies. Content that claims that any group or individual has immunity to the virus and cannot transmit the virus. Social distancing and self isolation misinformation. Content that disputes the efficacy of local health authorities or World Health Organization guidance on physical distancing or self isolation measures to reduce transmission of COVID 19. Content that denies the existence of COVID 19, denial that COVID 19 exists, claims that people have not died or gotten sick from COVID 19, claims that the virus no longer exists or that the pandemic is over, claims that the symptoms, death rates, or contagiousness of COVID 19 are less severe or equally as severe as the common cold or seasonal flu, claims that the symptoms of COVID 19 are never severe. Educational, documentary, scientific, or artistic content. We may allow content that violates the misinformation policies noted on this page if that content contains context that gives equal or greater weight to countervailing views from local health authorities or to medical or scientific consensus. We may also make exemptions if the purpose of the content is to condemn or dispute misinformation that violates our policies. This context must appear in the images or the audio of the video itself. Providing it in the title or description is insufficient. Examples. Here are some examples of content that are not allowed on YouTube. Denial that COVID 19 exists, claims that people have not died from COVID 19, claims that any vaccine is guaranteed prevention method for COVID 19, claims that a specific treatment or medicine is a guaranteed cure for COVID 19, claims that certain people have immunity to COVID 19 due to their race or nationality, encouraging taking home remedies instead of getting medical treatment when sick, discouraging people from consulting a medical professional if they're sick, content that claims that holding your breath can be used as a diagnostic test for COVID 19. Videos alleging that if you avoid Asian food, you won't get the coronavirus. Videos alleging that setting off fireworks can clean the air of the virus and will prevent the spread of the virus. Claims that COVID 19 is caused by radiation from 5G networks. Videos alleging that the COVID 19 test is the cause of the virus. Claims that countries with hot climates will not experience the spread of the virus. Videos alleging that social distance and self isolation are not effective in reducing the spread of the virus. Claims that the COVID 19 vaccine will kill people who receive it. Claims that the COVID 19 vaccine will be used as a means of population reduction. Videos claiming that the COVID 19 vaccine will contain fatal tissue. Claims that the flu vaccines cause contraction of COVID 19. Claims that the COVID 19 vaccine causes contradictions of all other infectious diseases or makes people more vulnerable to the contraction of other infectious diseases. Claims that the COVID 19 vaccine will contain a microchip or tracking device. Claims that COVID 19 never causes serious symptoms or hospitalization. Claims that the death rate of the seasonal flu is higher than the death rate of COVID 19. Claims that people are immune to the virus based on their race. Claims that children cannot or do not contract COVID 19. Claims that there have not been cases or deaths in countries where cases or deaths have been confirmed by local health authorities or the WHO. What happens if content violates this policy? If your content violates this policy, we will remove the content and send you an email to let you know. If this is your first time violating our community guidelines, you'll get a warning with no penalty to your channel. If it is not, we will issue a strike against your channel. If you get 3 strikes, your channel will be terminated. Comrades, we need you to do what is right and to stop wrong thinking and to start doing what the overlords want us to do.